Why don't doctors love vape?
Hello, I'm Dr. John Oyston. I'm an anesthesiologist and I've spent 40 years working in the operating room helping to care for smokers while my surgical colleagues attempted to undo the damage that smoking had done to their bodies. I'm appalled that the tobacco industry still exists and continues to profit by poisoning people. I don't want young people to start smoking, and I want adult smokers to quit smoking as soon as possible by whatever method they can. When I first heard about vaping, I was really excited. This is something that gives smokers a cigarette-like feel. It gives them the nicotine that some of them need, but it doesn't contain any tobacco. It doesn't contain any of the tar, the poisons that are produced by burning tobacco leaves. I thought the medical profession would be really pleased to find another method of getting smokers to quit smoking. Physicians only seem to view vaping as a danger and as a threat. Why is that? I put it down to three things. It's a combination of ignorance, a lack of standards, and medico-legal concerns. So physicians are ignorant about the true benefits of vaping. They've seen the tabloid headlines, but they haven't actually read the scientific articles. They haven't read the reports from around the world that demonstrate that vaping is very much safer than cigarette smoking. For example, the risk of cancer from vaping is about 1% of the risk from cigarette smoking. They haven't read the randomized controlled trials, which show that smokers are twice as likely to quit if they use vaping as if they use nicotine replacement therapy as a tool. And they haven't seen the papers which say that smokers with COPD or asthma get better if they switch to vaping. So physicians desperately need education, but they're not getting it. In 2019, I went to the Ottawa Model for Smoking Cessation conference. I took the CAMH course on smoking cessation, and I was an observer at CAMH. And in none of these environments did I hear people talk about how best to use vaping as a way to get people to quit smoking. In fact, quite the reverse. They presented a scenario in which a smoker came asking for advice about how to vape, and they deflected the person and they sent them home with free samples of regular nicotine replacement therapy. I really had the impression that nobody in any of these venues actually had a plan as to how they could use vaping as a way to get someone to quit smoking. The second issue is standardization. Physicians are happy to refer somebody to a physiotherapist or a pharmacist because these are professionals that meet certain standards. But they're much less comfortable referring someone to a vape shop. So it would really help if there was some certification system for vape shops and if the staff were trained in smoking cessation. Also, there are no vapes that are currently produced to medical standards. It would be great if there was a vape that was made to medical standards, and then it could be prescribed by physicians and it could be covered by health insurance plans. The final issue is medico-legal concerns. Say, for example, you're a family doctor and you have 1,000 patients. Probably about 150 of them smoke, and maybe 75 of them will die from smoking-related diseases, which is tragic. If you could persuade all these people to switch from smoking to vaping, then you'd probably save about 50 lives. But vaping, like any other serious medicine, isn't completely free of side effects. So it's possible that 1 or 2 people could have complications from vaping, or they may even die as a result. So where does that leave the physician? I spoke to the CPSO, which licenses physicians in Ontario, and they explained that it's the physician's obligation to explain to the patient the risks and benefits of all the available treatment options. And provided they do that fairly and accurately based on the scientific data, they've met their obligation and their license is safe. The CMPA went one further. They said that if someone had a bad outcome, for example, they died of lung cancer after decades of cigarette smoking, and a physician hadn't done something that could have prevented that, for example, they hadn't suggested that they try vaping, then the physician could actually be held liable for not recommending vaping. That's certainly not how physicians look at it. I'd like to conclude with some comments to Health Canada and similar regulatory bodies around the world. Vaping is working. It's reducing teen smoking, it's helping cigarette smokers quit, and it's providing an alternative source of nicotine for smokers who are addicted to nicotine. Currently, governments around the world are looking to increase regulations about vaping. They're looking at increasing taxes, they're talking about flavour bans, and they're talking about limits to nicotine concentrations. All these things are going to make vaping less attractive to smokers. This is going to result in more tobacco use and more deaths. It's unfortunate physicians and governments don't love vaping because they're blind to its benefits. This is something we need to change. Thank you.